3:30. So just
Good afternoon, everyone.
yeah.
Let's call to order our August 28, 2025 Region 2 Larimer County Council meeting. I am Tom Gonzalez, I serve as the chair. Let's see, do we have a quorum here? Who's all online, Brooke? Hold on. Thank you.
Yeah.
Hi, David. We see you, David. David, we've got 1, 2, 3, 4 voting members. That is a quorum, isn't it not? We have 6, 7 members. My brain is not working today.
Yes, we do. It's 7 now, I believe, because we added 1. So that's still a majority of
Oh,
them.
Brian, I just see, thank you for that. Mayor Pro Tem Mason. So we have 5 members. We definitely have a quorum.
Sorry, I was cutting my head and I was like, wait.
No, I welcome everyone to the meeting. We'll get going here. Our next agenda item is public comment. Is there anybody that would like to make public comment that is not on the agenda? Anyone online? Seeing none, we will close public comment. Thank you. We're going to move to agenda item 3, approval of the 24 July 2025 meeting minutes. Yes, ma'am.
Mr. Chair, I would like to move to approve the minutes as presented in the packet.
We have a motion. Do we have a second?
Second.
We have a second from Rupa. Any further conversation regarding the minutes? Hearing none. Does anybody oppose that motion? Hearing none, that passes unanimously. Okay, let's move to agenda item 4. Approve reimbursement to finance for the lived experience stipends. I will turn that over to Janelle. And can we have the packet up, please? Thank you.
Yes, thank you. So in your packet, I have a request, and I'm looking for approval from the ROAC to reimburse Larimer County in the amount of $1,000 for the lived experience stipends that were paid in February. And that was for 2024 stipends.
We're getting to that page. Right there. Perfect. Thank you, Tom. Okay. Any other things to add, Janelle, on that?
That is it.
Yes, Commissioner.
Mr. Chair, I think this is really important, and I know we have discussed this in the past. I would like to make a motion to approve this administrative cost to reimburse Larimer County for the volunteer council stipends with the amount of $1,000.
That's a motion to approve the stipends. Do we have a second?
I'll second.
We have a second. Any further conversation or questions regarding the stipends? Yes.
I can't recall what it is per person, so I don't know how many individuals were accepted that stipend.
This was 2,
Okay.
and it was for 2024, paid in February 2025.
Okay, and are we seeing a good representation of acceptance on that, moving forward with the different lived experience?
I'm honestly not sure.
Okay.
From what I can gather, she did that in December. Carol did that in
Okay.
December and for our January.
Yes, Commissioner.
I do believe a 2 is 2/3 of the lived experience.
Yeah, that's good.
Yeah, just curious. Yeah, but thanks for the question.
Yeah, great question. Any further questions or comments? Hearing and seeing none. All right, we'll take it to vote. Does anybody oppose the motion? Hearing or seeing any, the motion passes unanimously. Thank you for that. Thank you for your volunteer work. It's very, very important to hear from all voices. Okay, moving to agenda item number 5, back to our grant administration. We'll kick this off. This is, we do have, if I can get my agenda to stay, we do have 3 presentation proposals in front of the council. Now, if you recall, we have about $212,000. John, would you correct me on the exact number that is in the budget that we put into this section, the equity section?
Janelle would be better able to answer, but I believe that is the 215 approximately.
Thank you, John.
She might have the exact number.
Thank you, John.
$215,043.
So we have $215,043. And we have been inviting folks, going through Jessica Plummer as our advisory member in the Laramore County Behavioral Health Services on services that are already being utilized throughout the county to see if they can expand to our concentration areas. And those concentration areas are for our youth that have been experienced trauma from drug overdose or drug consumption, primarily with parents or loved ones or caregivers, and also with our Latinx community. So that's really where we're specifying some of this work. So we have 3 of those coming up for the ROAC consideration. The first one is EVIX, which is Estes Valley Family Resource Center. They're going to come make a proposal that's in your packet. They have 10 minutes to give the proposal, and we'll leave some time for questions. Sorry, it is pretty fast proposal, but we really are excited you're here, and we'll turn it over to you.
Well, thank you so much for inviting us to be here today and apply for this resource that is really meaningful to our community. As you know, we are located in Estes Park. I'm sure you've been there. It's beautiful. We are so blessed to have mountains, waterfall, wildlife in our backyard. And I want to address a little bit about what I've personally heard about the misconception in Estes Park, that people that live in Estes Park are wealthy, that people are there on vacation.
Sorry to interrupt you. For the record, can you please introduce yourself?
Yes, my name is Ruth Miller. I'm the Executive Director of EVIX Family Resource Center, and I'm located in Estes Park. But that is one of the things I personally heard. But the reality is that the people that make Estes Park that welcoming community for all our visitors from all over the world struggles. That's our workforce. That's the people that are making Estes Park that beautiful place and welcoming place. So we lack resources. And so EVIX, I want to talk a little bit about what we do, who we are as a Family Resource Center. We were founded in 2005 as a early childhood organization that focused on that field. But quickly we realized that in order to support children, we needed to look at the overall well-being of the family, parents, youth, children. Healthy parents, healthy families, create healthy children. So in 2019, we became officially a Family Resource Center, and we were able to expand our services and to also work with families. And recently, we hired more staff, and we have more capacity, and we are expanding little by little to serve also our youth. This specific program that we are proposing is very personal to me. I'm an immigrant. I moved to the US in 2012. I left everything behind. I left my career, I left my family, I left my job, I left my friends. And so it was hard, honestly, to start from ground zero, to learn a language that I hardly spoke at that time, and build that connection, build belonging. The pandemic hit me very hard, physically, mentally. It was very hard. I was living in Texas at that time. The opportunity opened up. I moved to Estes Park, and nature gave me hope. I didn't know anybody there in Estes Park. I met EVIX Family Resource Center, and that gave me the opportunity to build community. I was hired in 2021 as a family advocate. My role was to build relationship and trust among the Hispanic community. I was like, I'm new in this community. How am I going to do this work? But I knew that my personal experience would resonate with my community. So it was a success. Our outreach was amazing. We started seeing our Latinx community coming to our center, building that trust, and they felt safe to access resources. One day, one lady came to my office, and she specifically was looking for me. I have a tiny office, very confidential. I was a family advocate, and she was welcome in my office. We sat down, we talked, and she broke down. She didn't speak English. She only spoke Spanish, and she shared with me her struggles. She shared with me that she was cutting herself, and she showed me her arms, and she told me that she was taking these pills to appease the pain that she was going through. At that time, that was my first experience with this issue in a spark among the Hispanic community. I took that at heart. My goal was I need to find resources for this woman. I reached out to my partners. There was none, and there were providers, but they didn't speak the language. This woman didn't speak English. Eventually, we found a provider through telehealth that was able to help her. So with the support of a family advocate and the professional, this woman got better and better. And that was that glimpse and that realization of like, this is a reality here too. And this is a reality among the community that doesn't have access to the resources that English speaking individuals could access. So we got to work, and we reached out to our partners in Port Collins, other nonprofit, and we shared with them, hey, this is a reality. This is a struggle that our community are facing, our workforce there. That those people that are making us part of that welcoming place are struggling with mental health. So our partners were very, very supportive. So we got a 3,500 seated mini grant to start a program. But before starting the program, we wanted to really understand more in depth the reality that that community was facing. So in 2022, we launched a survey specifically for the Latinx community. We wanted to understand, even though we have a theory, we wanted them to tell us these is our barriers, and we did. We hosted also listening sessions where we invited all our partners in our community to also hear that issue from themselves. 173 individuals fill out that survey. 30 people came to our listening session. May I ask you, what do you think was the number one barrier for Hispanic individuals that don't speak English? What was the first barrier? Just, what do you think that might be? Language. What's the language? Bingo. Language. Language was the first, the number one barrier, like 100%. Everybody was saying language. We would love to have a resource where the provider can speak our language, understand the culture, understand where we're coming from. So definitely, we had a little money, and we partnered with a provider from Port Collins that was driving to us every Friday, still today, to provide that support to that family or to those individuals that were coming. As we were evaluating the program and the receptiveness of the service, we saw 50% male and 50% female accessing the resources. That's in the Hispanic community, Latinx community. For a man, as can be in other demographic, is huge for them to realize that they need help and that they are seeking help. That really showing us that we are building trust, that they feel safe, and that they can come to us for support. As we are expanding, we are realizing that we need sustainability. We need 2 minutes. We need sustainability, and we want continuum of care, and we want to expand this to our youth and families. We are talking to our school district, police department. We are a part of our monthly mental health, behavioral health group, as some of you are probably attending as well in SS Park. We ask our partners, what is the thing that you see that we can play a role there? as a family resource center, and they were telling me youth and families are the need. And so as we are working to enhance our program and expand accessibility to our youth, we are proposing, and that's the reason why I'm here today, to create resources within ourselves. There are individuals in our community who are qualified, who have degrees in this field. And they, when we identify two, that can go through training to become peer support specialists, to provide peer support sessions or groups to our youth and families. So those individuals that are accessing our one-on-one therapy sessions can then move into the peer support. And also, our school district are seeing this as a role that we can also play in regards to youth that are having this access to opioid consumption and are going through treatment as well to access these peer support groups that we can provide. So we are today to request and to apply for this grant to have these individuals in our community go through the peer support training to become peer support specialists and be a part of this overall plan that we're having in Estes Park. And I'm here to answer any questions you may have.
Wonderful. We've got the budget up. So questions, the bottom number, is it, what you're looking for on this proposal is $28,792?
Yes.
Okay. Council members. Yes.
So Ruth, thank you for coming down and presenting this. And we had talked earlier the other day about how you were going to also talk with Ruby in the school district and be connected closely with them as well. There are a couple already, CSU, the Blues program, working. Are you familiar with those as well? Okay. And it would be nice to have a collaboration with them so we aren't, I don't want to, which I don't think you're doing, but I don't want the same thing to be getting addressed as another group is doing. So just to make that aware. You'd spoken about having already knowing of a couple that are qualified or interested in going through this program. Curious, how is that, just quickly, is it your research beforehand to provide this documents and stuff to us that you reached out, or was this something that just kind of fell in your lap? I'm just curious.
Thank you for your question, Trustee Youngman. This was, it's a result of our program, the evaluation, and also the feedback of our community members and the clients that are coming to us, as well as our partners. This program actually, we work on creating last year. We already were seeing that the program is being successful, and we are looking at the continuation of like, how can we support these individuals that are going through the therapy and sessions in staying connected in that peer support group, but also discussing with Ruby, discussing with the police department, that's great partners as well, talking to Harmony Recovery, Soundstone, Crossroads. Definitely the area of youth is a need, and we have the capacity now to be able to say, hey, we can take this on. We have been thinking about doing this and develop this program draft last year. And now as we are pursuing hiring the bilingual therapists, which we were approved. So that's happening, it's gonna happen. So that is a huge component of the overall plan that we have in regards of mental health and behavioral health that EDIX is working on. So these individuals came to us because they wanted to be a part of the plan, of the program. Like, I have this degree, I have this training, I have this. So what can I do? How can I help? How can I be involved? And so our concept is our concept is really, it's so hard to bring in people from Port Colony, Loveland to Estes Park.
Yes.
The concept is how can we develop and create resources within ourselves? That was our kind of like vision. And we have these individuals that are interested. And so we are like, this opportunity come up and we are like, this is great. This is aligning with what we are moving toward. And so that's why I'm here today to propose these. And
Great, thank you.
yes.
Yes.
Thank you for coming down. It's really good to see you. And I'm curious, you mentioned the Friday therapy sessions. I don't know where funding that's coming from. Will that continue in addition to this, or is that something?
So our idea now, that provider is coming from Fort Collins. And so the issue in the winter is driving to Estes Park. And so our hope was to hire, which we are in discussion with, a bilingual therapy that will be in-house. We live in Estes, we're working with the housing authority to get housing for this individual. We're really working hard. That will continue, that therapy, that clinical piece of the whole program will continue, as well as what we want to introduce, the non-clinical piece of it. Just to open it up. That complement the whole program.
Awesome, I appreciate that. Thank you.
Yes.
Just a quick question, which organization are you working with in Fort Collins?
Isaac?
Okay, yeah.
Yes.
Thanks for the work you're doing. So 2 peer specialists, at least 30 unique clients a year, and then weekly meetings?
So, okay, this is the thing. Because I'm budgeting like a 10,000 for the peer support and around like 250 hours. Our desire is like as a minimum. If it can be more, if it can be weekly, that would be great. But as a minimum, like twice a month, support group, bilingual, youth focus.
That's a very efficient use of funds compared to some of the other people we fund. Thank you.
Are we looking for a motion? Because I would like to make a motion. I do think this meets kind of that geographic need, and also it seems like it's a really boots on the ground kind of organic kind of program and addressing a need that's been identified in the long term in this community. And we know the service industry in Estes Park has a lot of needs with housing and other things. So I would like to make a motion to support this proposal for the amount of $28,792 for to address maybe some equity needs in Estes Park. Thank you.
I'll second.
There's a motion and a second. Further conversation?
Yeah, I guess I would ask that we wait until we hear from all 3 proposals before making a decision, because we only have the $250,000 pot, right?
We do, whatever the number, 215,000, yeah.
What's the total request?
What's the total amount though? It's a good point, but I thought it was less than what we have.
Yeah, I thought when I did it up.
I thought it was slightly more, but I was doing that in my head.
Is it more?
How much more?
Because we have La Familia that we still.
Yeah, you have Crossroads Ministry of Estes Park Law Familiar, and they give 2 proposals on each, where you can pick one or pick both, so there's like a menu.
Yeah.
So, so there's options provided. Any further conversation? Yes,
Not conversation, just comment.
yeah,
Because you're starting this peer specialist initiative, there are so many, or there are other organizations in the back that are doing peer support, that if you connected them while you're here, it would be really valuable use of your time to connect to several organizations, like in the Blues program, to connect with some of those folks for peer support, because they've done it.
Yes.
They have everything like up and running, and you can get up and running a lot faster if you connect with some of the folks in the back.
any other conversations?
You know, I hear that, that's what Rupa had said. Although I really feel strongly about, you know, not that Estes Park has been left out, but it is a difficult area because most everything is more convenient down here, and of what we funded is down here, and not too much goes up the hill. So I would really strongly propose that we fund this at the full asking to really be able to focus on Estes Park, I think is very important. But I'm willing, if the other board members feel we need to wait to the end, I would be willing to do that. But I just feel strongly that Estes Park needs to have, has a big need for this type of thing, and it's hard for those that are working in the valley to, the cost prohibitive to send people up all the time.
Yeah, I would agree. Working at the Estes Park for 7 years. This is really the first Estes Park proposal and we're talking, I appreciate you coming in with this lower money to get this rolling. I do believe this is something we should move forward on as well. Does Mayor Pro Tem Mason have any points before we take the vote? I'm asking because I don't see your face. I want to make sure we're not missing you there, Brian.
Oh, sorry about that, Chair. I got stuck on mute there. No, I fully agree with Trustee Youngland on this. I do want to see some funds make it up the hill to Estes Park, and I think this is a excellent example of a good use for them. So I would fully support this.
Any further conversation? Wonderful conversation. Well, we'll take it to the vote. All those in favor of the proposal and the motion, but signal by aye.
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 Anybody opposed? That passes unanimously. All right.
Thank you very much.
Thank you.
Thank you, Ruth.
Okay. Yes, ma'am.
I'm sorry to interrupt. I know we're short on time, but I just wanted to thank Jessica for mentioning this opportunity. I think that was a great idea and just wonderful opportunity to do that. So I wanted to say thank you, Jessica. It's really thoughtful of you. So
Jessica's a rock star.
I know that.
I get to work with her quite often. I enjoy it.
Me too.
Yeah. Crossroads Ministry of Estes Park is next, talking about Estes Park. All right.
Representative will be online.
Okay, presenting online.
Hello, everyone. I'm actually Brian Schaefer's stunt double today, so he wasn't able to make it. We met earlier this week. He asked if I could attend. I'm sorry I couldn't be there in person. So my name's Shane Hudson. I'm the CEO of Harmony Recovery up in Estes Park, and we are one of the two agencies who would be working on this together, but Crossroads Ministry would be the grant applicant and grantee if the funds came through. So I've been at Harmony for a little over a year and a half, worked at a treatment center in Kansas and was CEO there, worked at the center for 13 years, CEO for 6. So my experience working with communities and having STR and SOR funding and really focused on opioid use and other substance use disorders, as well as city and county opioid abatement dollars. That's really a lot of what we did in Kansas. Now, coming out to Harmony and being in Estes Park, Harmony was a different type of organization. It's been largely commercial and private pay and had not ever accepted Medicaid. So when I came to Estes, I started joining the behavioral health committee every month at the library. I chair that group now and work with agencies such as EVIX and Crossroads, the PD, et cetera. There's a good group of people there who really want to create solutions in Estes. And my first question was, how do we close this gap between Harmony, this amazing resource for addiction healthcare that's been here since 1969, and the community that's sitting here who could really benefit from services? Because while the majority of people came from Colorado to Harmony and some across the country, I'd say very few locals were getting connected in the right ways. So really meeting with stakeholders in the community, the PD, the school, Crossroads, the group at the Behavioral Health Committee, and understanding what we could do to help support the community. So we started accepting Medicaid patients in January at Harmony, and Brian and I have been talking from Crossroads for the last year about what we could do to further support the work that he and his organization are doing. Because when I came in, I just heard from a bunch of people, I need to meet Brian. He does so much in the community, learned about the therapy services, transportation, food, housing, everything they get involved in, which is fantastic. And just trying to get a lot of things updated at Harmony before we stepped into some opportunities. So Brian and I met and discussed this grant and application of how could we help? How can we bridge this gap? So Crossroads, I'll speak to those services as best I can, and I'll speak to Harmony services. What we discussed was how do we create the right services in the community link people to Harmony when they need it, but not everyone needs that service or wants that service. We can accept them or coordinate care to other facilities if that's what someone is wanting. However, one of the gaps there is for adults in the community to really get peer support and have that sense of community with others who are in recovery or trying to find recovery. Getting, of course, along with that, other services, mental health counseling, food, housing, transportation. Those are very important because it's not just about the substance use. And if someone stops that, things are great forever. It's about all these other layers and everything that people deal with every day that can cause stress, triggers, reenact what was occurring before because things just aren't working well in other dimensions of their lives. So with this, Crossroads would be actually providing a lot of those services to link into the person's lives, in their homes, in the community, as they're looking for job placement or education, housing, childcare, et cetera, along with mental health counseling and therapy services. I know one of the things Brian had mentioned to me that while the application says something about 40% of the households has Latinx, he told me 60% of the total client database that they've been serving are actually Latinx. They do have a couple of bilingual staff, one being a virtual therapist at this point, but they're looking to, they have someone who may be coming in to do in-person bilingual and Spanish-speaking therapy services. So Brian and his group have been doing a great job with that across the community and want to continue that to expand, but also have some support specific to addiction peer support and recovery. So at Harmony, we have two alumni coordinators is what they're called. They're certified recovery coaches or peer mentors. And we're looking at hiring a third. So with that third, we said, what can we do in the community to really face towards the community and link people to the right services? So our discussion led to us saying, well, let's have that person situated in Estes, sharing some office space at Crossroads, being available, holding support meetings throughout the week, and really engaging with people who may or may not want treatment. But if they do, we can link them in. And if not, we can meet with them and really support them as Crossroads also supporting them. So with that group, not only do we have those two peer mentors, but we have about 10,000 active alumni. We have 5 current alumni ambassadors. A few of those are local and they attend events on our campus and they work with patients that are coming in and out of treatment. So the other idea there is local events and how can we engage with people in a positive way? And really, how do you create events that show community and support, but also have fun sober so that people feel involved or have people to go with them to attend events? So that would be, in a nutshell, the service that we propose offering. The total amount requested would be $157,800. $103,800 would go to Crossroads for their therapists and the services that they outlined in the application. $54,000 to Harmony. That's most of a full-time staff for us. It's actually about $70,500 with benefits that we would pay a peer mentor. So that would get us quite a bit of the funding for that position to come on and be a local point of contact and service within the community.
Wonderful presentation. Thank you. Questions? Yes, Commissioner.
Thank you, Shane. It's nice to see you again. And I'm curious about when you talk about, I think this is kind of your equity piece. I know you said 40% of, but you had shared a different number, maybe it was 60%, but I'm wondering, are you saying this equity is for the Latin community and Spanish speaking, or is it also for folks who have cost barriers? I'm trying to understand kind of the cost, the equity, how you're addressing that.
Yeah, it is for both groups, and obviously there's crossover within those groups. Obviously in Estes Park, as was described by Root, that we have individuals who honestly can hardly afford to live there. We have individuals who feel disconnected because of language barriers. My wife works in the school and I totally support youth services and especially Spanish speaking youth services, and services for families in Estes are very important. So obviously with Brian's group and Crossroads, they are serving individuals who are below federal poverty guidelines and often have a hard time affording the cost of living in Estes Park, or they live nearby and they're accessing services through Crossroads via the Estes Valley at large. So yes, it would be both. It would be low income as well as Latinx.
Okay, thank you.
You're welcome.
Just to recap, did you say that position, they would be have an office in Crossroads? But what is the distinction of time for the different Crossroads or is there a distinction of how much time is devoted to Harmony and how much to Crossroads clients? Or was there?
Yeah. So we had discussed a 50-50 split, obviously not just the salary for the staff, but the oversight, and there's data collection components. So we want to make sure all that's built into it. So we talked about 50% at Harmony, 50% at Crossroads. So they're out in the community. Obviously, as we go along and depending on volume, I want to follow the need as it exists. So we'll just build in that direction for the year and make sure we engage with as many people as we can.
Okay, thank you.
I'll go with Ruth.
If you had to prioritize the positions, how would you prioritize them?
Oh, sorry. Was that a question for me?
Yeah.
Yeah, we do. I don't think he heard you.
Oh, sorry. So if you had to prioritize the positions, how would you prioritize them?
I would prioritize, let me look at Brian's budget. I mean, my first reaction to that question is to make sure there's mental health therapy and case management service and a peer mentor. So when I look at the breakdown as far as therapists, we have 2 therapists listed. They're 0.2 FTE a piece, so it's not a full-time position. And then we have wraparound services in a few different categories. And then we have the Harmony peer mentor. I would say therapy and keeping those therapy services available in the community are very much important. I would list those as number 1. I would list the Harmony peer support because we just haven't had that out in the community and facing that space. And I've been asked about a few different groups in town. What about getting something like this going? I rank that up there. I don't want to put that last on the list, but also with the wraparound services, housing, food, transport. It's kind of difficult for me to break this down because I believe that a therapist, a case manager, and a peer mentor are really going to be solid components to have together. I would hate to cut one off. I suppose, oh man, I would probably keep food, housing, therapy, and peer mentor as my top on the list.
Thank you.
Commissioner, did you have your hand up?
Yeah, I just,
We'll go to you.
thank you. I appreciate it. And I just want to kind of build off that question that Rupert asked is, I hear mental health and things came, and I know I read through I was trying to read back through, but these are for opioid dollars. And so for opioid abatement and for things. So but it sounds like this is going to be more of a broader mental health kind of thing as well. So I know those are core occurring activities and situations, but how would you be focusing this money on helping with that area? And also, since we have the school district and the Blues and the Crossroads and also what EVIX is trying to do, how can you, because the area is so unique, how could you do that to focus on that and also leverage and work together collaboratively? Because I know behavioral health impact grants focus that as well. How would you be able to do that and also focus directly really on opioid abatement needs? Thank you.
Yeah. So depending on who you ask, and the data show a high percentage regardless, but 75 to 90% of individuals with substance use disorder also have mental health symptoms or a mental health diagnosis. So treating mental health along with it as you talk about the greater behavioral health need, addiction, and a mental health symptom presentation or diagnosis are highly common in the individuals we serve. The focus group would be those who have an active substance use disorder or a history of substance use disorders. There are risks that people switch to opiates if they have not been prescribed them or used them illicitly already. So focusing on substance use disorder is number 1, specifically opiates. I know in Kansas, there was a focus on if there's other substance use disorders, there's risk there or history of opioid use. So focusing in that direction, treating the needs that exist within that community and those individuals, because there will be mental health symptom presentation with the majority of them at the very least, if not diagnosable conditions or already diagnosed conditions. As far as working with other individuals in the community, through that monthly group, we discuss case consultation. So de-identified, no HIPAA involved, but we lean on each other to talk about what the needs are for an individual in the community. Have they tried this? Have they tried this? How can we support each other? We link resources within that group that has the school present, that has EVICS present, that has the police department, that has Crossroads, Harmony, Summit Stone, the county. So we're working on that on a regular basis already. And really, the lack of resources in Estes is evident. As soon as you ask about it, you hear gentlemen at the police department or ladies and gentlemen at the police department saying, yeah, I wish we had something to offer people and we just haven't been doing that, but that'd be great. We can link them to services. So I think more and more, as you say, the service is available, there's more and more people linked to the service through those formal communications or otherwise. So we would definitely support each other in that process. And there's a greater need than people would expect for a 6,000 person town and a 13,500 person valley. And I really think it would be money well spent in the area.
Thank you for your answer.
You're welcome.
Yes, DA McLaughlin.
I was curious sort of more how you go about allocating those wraparound services. You know, for instance, is the food services through the food pantry, and sort of how is that distributed amongst these folks specifically? And then when we're talking about housing, you know, we've sort of heard that, you know, cost of living and sort of housing is so difficult in the Valley that, you know, is this allocation actually able to sort of achieve, you know, long-term solutions for people?
Yeah. So I can't speak as well as I would like to about this because this is really Brian's area, but I will tell you based on what I know and what we put in the application that Brian aims to serve 80 individuals through the services outlined as far as therapy and wraparound services. And what his focus is getting these vouchers. They do Meals on Wheels, of course, the housing support and assistance as well, that with the individuals who were eligible for this service and with these dollars, that they would be able to utilize these funds towards that goal of 80 individuals having access to the funds and the service. And if that's not thorough enough, I can make sure Brian gets you all a more thorough answer. But I would say as far as their internal processes, I don't facilitate that service, so I can't tell you specifically.
Okay. Thank you.
Shane, it's been a long time since I've been at the Harmony Recovery. Great work. What is the census there?
Yeah. So our average census this month is 45.5. Last month was 46.3, and the month before was 44 point something. So it's a lot higher than it was in a while. We used to have about 27 to 30 patients per day. And for the majority of my first year, that's where we were living. So census has really gone up. And now we have all of our 56 residential beds open on campus. And we also have 20 subacute detox beds where about 10 patients are on a regular basis. So there's 76 beds on campus, and we're much more full than we've been in quite some time.
And on the average, with that census, how many of them are Larimer County residents?
I would have to ask. I know our historical data showed 80% from Colorado, 40-some% from Denver area, about 15%, 17 from Larimer County, and around that from Boulder County. So if that gives you a sense of what I've seen within the last year, I don't have the most recent data.
Thank you.
You're welcome.
Yes, Commissioner.
I'm just curious, and I don't think I can ask this of you, Shane, but I wanted to know if David or Janelle or John, can we try to look at allowable uses? Can we use this to pay for food as wraparound service?
Wraparound services is an approved use.
As food to help with recovery? And
I'd have to dig into it a little bit more, but
If I recall, and it falls under like toiletry, all those things,
Yes,
the necessities, when you're doing that, we can double check. David may have even a better answer, but I do believe if it's it certainly should just be a portion of the proposal. If it was all food, yeah, that would probably be an issue, but certainly a piece of that we have funded before.
yeah, and I'm just curious because it is a larger amount versus the direct personnel cost, and so that's why it just kind of drew my attention.
Good catch. I had not noticed that.
I can look into it some more. I can let the council know that there are some provisions under treatment that talk about supportive housing as opposed to just housing, that talk about residential treatment. So depending on the context, how some of this food is provided, it certainly could be included in some of the approved purposes under the statewide. I'll look into it here as we sit here and see if I can find anything else that's more specific, but depending on the context on how that food's provided, it certainly could fall within a couple of these parameters.
Thank you, David.
You're looking,
Certainly.
Commissioner, you're looking at the wraparound services, 25,000 for,
So it's a total of 75 for all of it, but it's 25,000, then above was only 28,000 for the personnel. So
Got
it's- So to me,
Got
it just seemed a little heavier.
Okay.
And so that's kind of what drew my
oh,
attention.
good question.
That was sort of what prompted my question too. I do think it's an approved use, sort of what everyone discussed, but it did seem sort of outsized compared to some of the other ancillary things that we'd approved. I'm not opposed to it, but I just think it's sort of maybe worth the discussion.
It raises a great question for
Yeah.
sure.
I'm having, I've been through the information, but I can't quickly come up with, I see the Crossroads Ministries chart. Where is Harmony Foundation's chart then? Because this is under Crossroads. Yeah, that one. But the ask is for more than that, so where is the other chart? Right? Or am I confused?
There's another page in my packet that has harmonies listed.
So I see that one, but what page is the other one?
It's on page 27
Page 27?
on the PDF. So there's one for 103.
Weeks.
There's another one for 54. Yeah, that one there too. Yeah.
So is there two houses then?
Yeah,
Yes.
it's 2 S.
Yeah.
So is it, so is this, because it doesn't specify if this is
Yeah.
for Crossroads?
Yeah, I
Or
have,
for,
I had kind of, I was trying to navigate that too, I
Well,
agree.
it says it there on the position.
Oh, there it is, that one, okay.
Yeah, so we would be a subcontract service with Crossroads. Crossroads asking for the majority of funding. We decided to have
That's the-
Crossroads apply.
Okay, thank you, that's helpful.
Yes,
thank you, I haven't been able to find that one, okay.
Other questions?
I just have a comment to the response of the question asked by Chair of, where the people are that would be getting these services. This is Larimer County money. How do we make sure that, it's mostly for Larimer County individuals and not people from Denver or out of state or whatever.
Right.
And I think Crossroads is definitely more in the county. I think when we get into Harmony, I think is where we get a little bit of sloppiness into where maybe those funds are, who those funds are really helping, if they're county or what. So that's just a little concern I have.
Right. Well, definitely. I mean, Harmony's in Larimer County, and you all know that. The staff being placed at Crossroads would be serving, obviously, people passing through that space would be 100% Larimer County and Estes residents. When the staff's on campus working with individuals who are in treatment from Larimer County. But once again, I mean, putting their focus on the local community and the volume that comes through this service via Crossroads is really where their time would be allocated majority of the time.
Thank you.
You're welcome.
If I can address the council briefly, I was able to go through all of the approved purposes that are attached to the statewide MOU. The only references that would incorporate anything that you could interpret as covering food have to deal directly with supportive housing, meaning that it would be most likely housing that they're either the food is attached to the housing component or residential treatment. So any food that's going to go with it would have to be tied directly to the actual treatment component.
Okay, thank you, David. That's very, very helpful.
So maybe it doesn't, I'm wondering if it, Mr. Chair, if it is attached or it's just separate to avoid fooding. So I think we might have to not consider that because it doesn't sound like it's supported housing or recovery housing. It looks like it's just in general to support housing and food in the community, which I think it's a very valid need, but I think since David said that, that's why I asked that, because I didn't think it was kind of tied to, it's not just in general to help with, in general housing or food, but to be attached to that. So
I thought this was attached directly for the clients that are through recovery.
but the Crossroads, no, I think it's in the community that is helping with housing, and I don't think it's tied to an actual.
It says client vouchers for grocery costs to support clients through recovery. So it sounds like the vouchers are gonna be given to the clients that they're supporting, right?
Shane, can,
That's correct. It would be for the individuals we're supporting through this program that are eligible for the services.
But David had said it had to be touched, the food had to be touched to the supported housing. Is that what I'm understanding, David?
And I don't believe there'd be a supportive housing element through Crossroads. That's not a known service they provide, as far as I know. And our residential treatment wouldn't pull funding from this for residential treatment, and people receive food and treatment. That's part of their treatment costs. So just to give a little bit of clarification based on my understanding.
Yeah, looking at the approved purposes, the only provision that I could find that could be interpreted deals with supportive housing or residential treatment. I certainly wouldn't dispute that you need to eat while you're receiving treatment, but the approved purposes in the MOU don't contemplate it.
Whether it's no, we'll have to remove that.
but one option we could have, council would desire, is we've heard the proposal, kind of like we did with the Family Center, have them go back, look at what's really approved and what's not approved, and tied to supportive housing, not, and resubmit at a later date. That's an option.
That's an option, or maybe really consider that. And I'm just trying to make sure that we're following the MOU and the need, but also, I mean, this is a need. We see this need everywhere, more food, more housing, but I want to make sure that we're, if we're gonna go down this route, which I think it's important, but also I want to make, I remember hearing this conversation and reading that in the approved uses, and it just kind of, when I saw that, that flashed in my head. So I'm not, trust me, I do a lot to support food insecurity for the last two decades or more. So this is not trying to nitpick. I just want to make sure that this will get audited, and we want to make sure it's being tied and used appropriately. That's why I asked David the question. So I'm open to that suggestion, Mr. Chair. Did we have to get this though, what timing sensitive with that money? I'm just curious.
There was no timing issues. I checked with Jeff Patterson.
Thank you. Then would you like, I can make that motion
Sure.
if you'd like, sir.
Yeah.
I would make a motion to table this proposal for another meeting and allow the applicant to maybe refine the application and ask to make sure it aligns with the approved uses. Would that be okay?
Yep, that's a motion.
Second.
There's a motion and a second. Any further conversation? Hearing none, we'll take that to the vote. Does anybody oppose that motion? Hearing none, that passes. So Shane, staff will work with you and your team and others to take that back. We've done this before. We really appreciate you coming in or joining us in this proposal. It's such a need. We'll work with you to get that back on next month's calendar if we can.
All right. Thank you. I appreciate it. I will visit with Brian.
Thank you, Shane.
All right. Thanks. Bye.
Okay, the next one, if you recall, is Family Center La Familia. They presented, we similar thing. We asked them to come back. So we don't need to have the whole presentation, but I do believe Gloria is here. Welcome, Gloria. Welcome back. And she will give what we need, and hopefully we can move forward on that.
Well, yeah, thank you so much. Good afternoon. So I'm here because there was a modification to my proposal. Thanks to Janelle for assisting me identifying the right code, because it's kind of very complicated. So we, you want to scroll down to where the approved uses are, please? So the approved use number one is under B6. I think it's further down. And the approved use number two fell under G0. So that's the change that was made to the proposal. So it's been corrected.
Okay, we got, and if I recall, you were two proposals, was that correct?
There is two proposed, yeah, exactly. There's two approved uses and two budgets that will go under each one of those approved uses.
Okay.
And it's, corresponding objectives. Those were presented last time. Do you want me to do a summary? Would you like me to do a summary of those?
We can go up there. The first one is budget summary B6. There's that one for $83,634.23.
Yes, sir.
And that is your peer recovery centers to expand those.
The social connections, yeah.
So wonderful. And then the next one, if we scroll down, is budget summary G.
Yes.
0O, which that's efforts to for disadvantage, prevent misuse opioids. Okay. Yes, Commissioner.
Hi, Gloria, good to see you. Thanks for coming back. I guess I had read through this, but I'd just like to maybe have you expand on this for me. Can you explain the contractual portion of that? This is the same in each one. Can you just explain and expand on that a little bit, what that means? And 'cause I was trying to read through it, but after reading several of these, my brain starts to blend it all together. But if you wouldn't mind expanding.
Yes, absolutely. So for the number one, for the peer support, which seems to be trending, but is really needed in our communities right now. I know that there are many amazing resources. I'm aware of Yarrow Collective doing the peer support training. I'm also aware of other resources that Abundance, the nonprofit organization, is also connected to. So we have voted and based our proposal under that potential contractual, right? We don't have it yet. With the idea of training 10 bilingual peer support specialists that could be co-located at different agencies. I was thinking, that Brian with the Abundance Foundation, they don't have anybody that is bilingual right now, and there's a big need. So it's not that we're gonna have those peer support specialists at La Familia. We could have one, but it comes to the idea of if we divide and we can cover other places where sometimes services are not accessible. I know that Loveland has a big need as well. So we're trying to train this cohort and really collect the data and make this program grow, because once you have that certification, it could be a career path for that person that is a bilingual peer support specialist. In the budget, well, I submitted the full budget, but it's not showing on the PowerPoint. So if you want to pull it out, it's part of the packet. So if you want to see the full breakdown, it's covering, the training itself, the materials, the interpretation, translation of materials, and staff time. And then some, just overhead, like expenses for whatever you need, like make a copy or things like that. So that's the number one. The number two is, it has a very heavy data collection component. So that's the approved use where it says increase of knowledge. So yeah, this is the full breakdown of everything that we're proposing. The second approved use has a very heavy data collection component, as I mentioned before, because we're trying to identify those barriers. And one of the questions that was asked last time is like, what does reparation mean, to the Latino, Hispanic community and migrant community? So that's the breakdown, the other breakdown that I have in the other budget. So that's why we have it into separate.
Thank you.
Yeah.
Yes.
Thank you, Mr. Chair. So when I had read the proposal, maybe I think I'm on the right one. It's on page 48. It talks about the 15,000 being with Valley Research and Evaluation for the focus on racial equity, cultural relevant content, community input. And the subcontractor will help develop evaluation tools. And so that's kind of what that is for.
Yeah, so we have always worked with an external evaluation. And they've been great, they really know our work really well, throughout the years, we have established a good relationship. So they already know the scope of our work. They have facilitated focus groups in the past, and it has proven to be very efficient in forming how we are delivering our programs. So that's Valley Research Evaluation is an external consultant.
And if I might, Mr. Chair, but the other contract for the 83 doesn't have to be determined for the $9,000.
I'm sorry.
It says in here, I think that has been decided, but on page 4, it says to be determined.
Where is that?
On the 83,000 on the next proposal on page 50. Maybe it's been updated. So would that be the same group or?
I need to find it first.
See 50. Can
you point?
Yeah, right there, it says to be determined. The subcontractor name and.
Oh,
it
yes.
says-
Oh, yeah. I'm sorry. Yes, I was thinking of the Valley Research. Yeah, because, we like to get at least one or two options to find the best one. If we could find maybe a resource that where we don't need to do interpretation or translation of the materials and it's in Spanish, it's a deal for us.
Right. And I'm sorry, I'm not trying to nitpick, I'm just trying to make sure we squeeze all this out. Can staff remind me, why am I thinking indirect could only be 10% or can it be 15%? Okay, sorry, I thought it was 10, but I could be wrong.
We can adjust it, that's.
Forgive me, it's just that, we've been through so many, is it 10 or is it 15?
There's not a limit for the overall budget, but as far as grantees and.
Okay.
Yeah, the issue was way more.
Yeah, I remember we had negotiated that, so, okay, maybe I'm confused too. I thought, you know what I'm saying? I thought we had to approve that to go above. I thought there was something that we had that had. But you know what I'm saying? Why is that like that? Rich, you should come sit up here. I was thinking. They're 20%, so. Okay, I'm just wondering, I'm just curious, wait a minute, there was something about 10 and we had discussed a direct cost before. And so thank you for showing me something. I'm not trying to pick, I'm just trying to understand.
And I don't have an answer.
No, that's why I'm asking staff. So I could be, like I said, it probably could have been a different meeting too, I don't know, so. Yeah.
Tom, can you go to the one that was the total 76,000, which had the promotores? It's spelled out right here. So here's an option, because on spirit of time, this one breaks out everything, and I really like this one. It does talk about promotores from a public health prevention side. That's something we've really been trying to promote and bring back in our community, that we used to have that, lost some funding. That is where you have community members helping community members. They're getting, it's not really a livable wage, but it's something, and they're really doing that work within the community. I personally, this one, really like this proposal and how it's laid out on the racial equity and the cultural relevant content promotora. So this is one I wonder if the council can consider moving forward, and we could look at the other one plus then our Crossroads Ministry another day. But I throw that out as just an option.
Mr. Chair, I think that's valuable feedback, and I value your input, because that hadn't drawn my attention, but I will, unless there's objection, I will go ahead and move to approve that first proposal at 70. Your recommendation, I'll go ahead and move to look for us to approve that first proposal with the 76,000 183.75. Thank you, Trustee Sullivan.
We have a motion.
Second.
For the seconds, further conversation, discussion? Hearing none. Anybody oppose that motion? That motion passes unanimously. As far as the other proposal, it would be the council's desire for Gloria to go back and break that down, those contracted costs like they do on this one, and come back.
I would greatly appreciate that, because that to me was really the confusing component of
Yep.
trying to decide. I liked from the presentation before, I definitely agreed here that this one was great, and I'm glad we got that passed, but more clarity would be great.
So what do you want me to do next step on the other one?
Yeah, we'll work with staff on breaking it, and just like you did on this one.
Yeah,
okay.
I thought it was superb,
Mhm.
and we'll come back at a later date.
Okay.
But this one is approved and
Okay.
we'll get it going for you.
Yeah.
All right, great job, Gloria. I'm looking forward to the work within the community.
Thank you.
All right, welcome to the table there. Appreciate having you. Yes, ma'am, sorry, Gina.
I just wanted to make you aware
Yes.
that after approving that and then the 28,000, there's 110,000, a little over 110.
110, that's good to know.
That was gonna be my question, Mr. Chair, just so we know going forward.
Now, there is option two, how much do we still have in admin after paying the first half of the year for 2025? It's,
290,000.
pardon?
290,924.
290,024, okay. That's just, that was more, but.
And Mr. Chair, just to remind, from the opiate advisory group, we were looking at a charter, and I know we're not presenting that today, but it's gonna be, I'm trying to get that on the next agenda, but that we're looking at maybe not having, because right now they're a separate grant proposal through the ROAC to them directly to do that work with Butler Group.
Okay.
And the suggestion would be to have that come out of admin and move that money for next time to have for future grantees and move it into more of admin costs. Since they're doing the data for the ROACs, it'd be kind of administrative costs. So basically just move them over to the other bucket and have keep more money in the buckets for the uses. And did I explain that correctly?
What I would suggest, I'd certainly be put on the agenda and we have a conversation
Yeah.
about it so that we.
So I just wanted to kind of bring up that's going to be coming forward to the left as a discussion. And with that new charter, with having to kind of have it. So that, I think it's kind of thing. So I just wanted to kind of highlight that.
Oh, thank you for that. Okay, moving on to agenda item 6. So I want to tee this up. So every year about now, we find out kind of where we're going to be landing for the next year's allocation. And then we've got to start prioritizing where we'd like to allocate those fundings. And we've really got, what is it, August, September, and October to do the heavy work. It's really important for us to get good rough estimates in by November 15th. That's the deadline for code. We now, if we say 25% for recovery and we want to move it to 30% later on, that is totally fine. But we've got to be pretty close. So that frees up the money beginning the first of the year to start funding our grantees. If we don't hit the November 15th mark, it's been March, correct? So now if there's a gap. So we in the past, this council decided, let's really try November 15th. Again, it is not set in stone. You can move around, but you at least got to give them somewhat of a framework. So what we did last year, we brought in the wonderful wise wisdoms of Dr. Jared Olson and Amy from our behavioral health services and Laura Walker, kind of taking a look at what has our community said there's gaps and needs based upon surveys, reports, those good work. We put that in front of the council for kind of a start, the conversation start. So we're going to do that again. But before we start, David, can you remind us what is what are we looking at for 2026 allocation dollars for Region 2?
You're gonna ask the lawyer for money numbers and not.
Yes, sir.
I have it as 2.6.
That matches the email I got from the state.
Perfect. Okay, thank you, David. I'm going to turn it over to Jared to walk us through this and get the conversation started. No real decisions need to be made today, folks. It's a discussion to tee us up for next month. So I'll turn it over to Jared.
Thanks, Tom. Jared Olson, Department of Health. I just want to do like a reminder here. So if it's not straightforward, please stop me and I'll see if I can clarify it. Okay, so we go all the way back one full year and look at what the board approved for these initial allocations. That's what we have up here. So there's been a lot of changes since then, but I just want to remind you what the board approved initially, with the understanding that there were going to be about 2.8 million. That's about 700,000 less than we actually were allocated for the year. So a lot changed. In that first category, you initially approved 25% in the broader category of recovery. Now that got spread out within some B categories in order to match state guidelines, but initially you said 25% to recovery. Then you came down here into J, the planning and coordination, and you also allocated about 25% of the funds there. If you use 25% of the funds of the anticipated 2.6 million, that would be about 650,000 in both of those categories. Tom, could you scroll down just a little bit? Thank you. Okay, then within G, you had two allocations, also for 25% overall to prevention. Those ended up being in a school-based youth program, as well as evidence-based information for prevention. Then for harm reduction, we had a 10% allocation that you initially endorsed. And then for treatment, we had, you can scroll down a little further. Look at my sheet, that's another option. I think it was a 15% allocation there, with 5% of that. So 10% allocated towards co-response, and then 5% allocated towards providing enhanced family support. Initially, that was not filled there. Okay, so that was the initial beginning of year 3. Okay, great. Any questions? Okay, if we could then go back up to the top, and then slide over a couple categories here. That's perfect. Okay, so then what actually happened was the actual spending. So I've broken that out by all the categories here, but then there is a percentage of actual funds. I'm going to step on this. Okay, so within that recovery framework, instead of the 25% that you initially allocated, as you got additional funds, you allocated 42% of the funds towards this category. That includes the to be determined $210,000. So if some of that moves to G, that would switch things up slightly. But so far, everything's been in B, recovered. Then that kind of adjusted so that there was about 17% in planning coordination, 14% in prevention. Scroll down a little further. Just about 6% in harm reduction, 11% in treatment, and then admin as well. So admin is probably your most flexible category that you could reallocate from. Obviously, there's two different frameworks here, right? The initial framework you intended, the framework you implemented, both with the equity considerations and the equity principles that you later endorsed, as well as what you did with the additional funds as they came in. So that is the introduction, and I'll hand it back to Tom.
Remind me, what reports did you and Amy and Laura Walker use to build this off of?
We looked at kind of best practices that exist out there, including the Osprey report from Johns Hopkins. And then we also based it off what you all had previously funded, right? So what was kind of the precedent that you had established there?
Perfect. I will pause it real quick. Thank you, John Boss. Just sent me an email. It's 20% max for indirect.
Thank you.
So we do have that number, 20%.
Cool. I just want
No, good question. It's hard to remember all of these numbers, especially all these tables. So.
Thank you, John. I am very grateful for the district attorney's presence today, Vanessa Fuel from Human Services, and Dr. Leslie Brooks. Thank you for being here today. And so we haven't really had your perspectives very often. So I'd like to, if Sheriff, I'd like to maybe ask right away from Dr. Brooks, put you on the spot. Just initial, with your amazing expertise, how does this land on you first glance? Thank you. Put you on the spot.
Hey, welcome.
I'm sure. She'll remember.
Stand up and run.
First of all, thing one, thank you for asking. Two, I think what's remarkable here, I'll just offer this, and I think this is true both here in Larimer and statewide, is just the focus on being able to understand where these dollars went. And taking a broad view of a 60,000 view of what gaps are we closing. And I think this is, I think across the country, there's been, a mad scramble to get these dollars out. And the attention to what did we do with these dollars has been harder to focus on. So one, I think the effort, thank you, Dr. Olson, is more than laudable. And I think, at first glance, I think this tracks. I think one of the hardest things we have to do in healthcare is to figure out how to work on prevention. So I think that tracks with, just how challenging that is to do. But I think that these areas for me cover really important places, and they're not all in one bucket, which obviously we didn't want that to be the case, but this tracks for me.
Thank you. That heartens me, so thank you, Dr. Brooks. And I'm sorry to put you on the spot.
No.
But I just thought you were listening. I thought, well, yeah, your initial reaction, thank you so much.
Well, put me on the spot. We'd love your perspective.
I would
And
agree.
welcome, by the way.
Hi, thank you, Vanessa Field, Department of Human Services. I would agree the diversification of the funding is nice to see from a continuum of care perspective. But I really wanted to highlight the childcare option here that's available. Given the current childcare need in Department of Human Services, we are certainly looking at meeting basic needs and thinking about access for parents to recovery services, to treatment and recovery services, is very crucial, which is why I also appreciated the conversation about housing, because the role of meeting basic needs in early recovery is crucial. So thinking about opioid use as a chronic and relapsing disorder, then having those early recovery services available for people that are often not funded in other ways is something that kind of emerged for me as a real need and priority, as we're seeing some of those other concrete support dollars being taxed by other populations. That could be something that the council could focus on.
Thank you.
Yeah, sure. I just want to point out that we were called on right after Tom said we don't have to be prepared until next meeting to discuss that. But no, thank you for asking. I sort of very intentionally try to do a lot of listening at these as the law enforcement rep instead of a lot of talking. That being said, yeah, I very much support sort of the priorities we're at. From my estimation, right, it's the folks that we don't see in the DA's office that is the success here, not sort of how are we utilizing it in law enforcement. And so, I think I support, and from when I speak with folks in the community, what they are looking for is sort of like non-law enforcement purposes in this, right? And really to honor that harm reduction model. And so I'm happy to support those things. I think we used to hear much more frequently in the courtrooms, like, well, my client has no options, so they have nowhere to go. They couldn't get treatment. They can't get treatment. We hear that a lot less now, I think, over the last 5 years. And definitely some of that is attributable to the work of this group. And so, I just hope to keep that going.
Thank you, sir.
Others?
I'd like to hear from Shane. What do you think?
On the spot?
Yes, on the spot.
Okay, what would you like to hear about specifically?
Well, I would like,
Broad strokes?
yeah, what you think about the division of where we thought and where we ended up, and what you're kind of feeling or hearing out there.
Thank you. I will echo a lot of what was just said. Gordon might have brought material to my eye. Quote you on that. Real. You know, what I really value about this council and the work that we've been doing is I'm seeing the effectiveness of the dollars we're spending in the community. The recovery community is growing in Larimer County, which tells me people that are suffering from substance use disorder are finding their way into abstinence, whether it is long-term or intermittent, and entering into recovery. And that is beautiful to see. We're all aware that overdose deaths, where most of our community are coming down, which is directly, related to the work that harm reductionists have been doing in our community and the increased resources that they have to do that work now. I would love to see more harm reduction services funded as it makes sense. You know, we're seeing less money coming in. We have lots of buckets. But the work that the harm reductionists are doing in our communities is unbelievable. It's amazing and it's underappreciated, especially in my hometown currently, which is problematic. The money we're putting towards housing is incredible. So grateful that we're doing that. I'm seeing the results of that anecdotally in the recovery community I'm a part of, right? When I floated that idea out, it was like, when you're early in recovery and you don't have stable housing, your chances are very low. There are so many people in stable supportive housing right now throughout Larimer County that's giving them that foundation to do the hard work and the heavy lifting that's required to be in long-term recovery. I love the work that we're doing. I think this council is very aware of some of my opinions on where I would like to see more money and perhaps less money. And that's okay, those are my opinions, but the work we're doing is incredible. I thank everyone that's involved in all the work in our community.
Shane, thank you on that. I do think it's important to know that some of the harm reductions, such as Narcan, the costs are up, going up. You can get some reduced costs if you're part of the marketplace. The health department is, so we can get those at a reduced cost, but so we can certainly partner with those. Our organizations are in that space, but that percentage might not cover what we've been doing just because of the increased cost. Now, everything else has gone up as well, but that harm reduction piece has significantly went up in the last couple of years. So that's the piece that we need. Yes.
I'm glad you brought that up, and forgive me, you know, I had that purple one box I brought back from the national conference. And it's, of course, I was at home I actually was meetings all around Loveland, and then I left in the office and said, last time I left at home. So I will bring that because I think it is interesting, especially for some rural locations. But I wanted to just share, you know, I went to, I think maybe Donato International Overwear's Day was this past weekend. And I saw MJ Jorgensen, I don't know, in the back. Oh, there she is. And I have to say, it just warmed my heart to see the amount of folks and the amount of vendors and to have that conversation. And that is not something we would have seen in some of the locations, maybe just even 3 or 4 years ago, maybe. But just to see the amount of people out and asking questions in the community, especially downtown Loveland and others. And I think that really kind of informs me that, you know, how I like the diversity of this and how we're trying to do this, you know, in lots of different buckets and address it in different ways. But I do agree with you about the cost, because I think before there was lots of folks getting just kind of flowing. But I think if we could be strategic with that, if we're looking at helping cover some of those increased costs. I know there was talk with it, and I need to make sure it's on my calendar. So the broader OB group having as a statewide or a couple of regions going into purchase in mass quantities. And I'm wondering if that is something we can, I don't know if regions could use money to help, buy in mass or something to help with the cost. So I'm wondering if that's something we have the conference coming up in October, and or maybe reach out to Jamie and all of them and find out if that's something we could save money overall for the whole state. So thank you.
We'll take that an item with staff to, we mark that down, Jared and Brooke. I think that's a great point. It is I don't think it is. To look at that, because there are ways to do some cost savings around Harvard, whether that's fentanyl test strips, Narcan, et cetera. And those folks are saving lives, and we're hearing the stories daily and day in. So that's very important. Moving forward, we do have one more agenda item in 5 minutes. Would it be the council's desire for our next meeting? We really got to dive into this and start prioritizing. There's lots of different ways we could go through those activities, but would it be okay to bring this back with those percentages as a starting point?
Yes.
Okay.
Which percentages, do you want them both, or do you want the actual, or the actual, what you actually spent the $3.5 million on?
Yeah.
Okay.
I would like to actually see both.
Okay.
I mean, just.
We could have both in the packet, that would be great.
I will split them out and do a separate document too, so that you won't have I'll make 2 copies.
Thank
Yeah,
you.
absolutely.
Making sure Mayor Pro Tem Mason, making sure we get to hear from you. Is that?
No, I think that plan sounds great. Yep.
Okay, thank you.
Can I clarify for the council's voting, will they vote on each subcategory in order to make the allocation, or just the broader categories?
Each subcategory.
It's a category, but I want to just say, I think, Mr. Chair, that last time we did move some things around, and we know, so I want to make sure everyone understands. I think it's not like we're chiseling this granite again, but also I think it was, you and I both attended that meeting where they said, we don't get this in November or October, then we won't be able to get the money until next year, and I don't know how that rolls with our rolling calendar. So I just want to emphasize for all of us, including myself, that to be thoughtful as we trying to get these approved so we can get the money sooner than.
Yes.
So looking at, for next meeting, so we would be able to have 2 meetings before we have to have it turned in?
Yes, we'll have September and October.
Okay.
And then we'll get to the next agenda item on the last meeting.
Yeah, I just didn't know if I know one time we had an extended meeting, and I didn't know if we felt we were gonna have to have one of those extended if we need to.
I think you need both of them extended for 2 hours.
Okay, that's what I was
I would
wondering,
go
if
2
you could
hours.
address that.
I will feel more comfortable as your chair trying to, we want to have good, thoughtful conversation. Hour and a half, I feel like I'm cutting you guys off. I really don't like that. So I would go for 2 hours if we make a motion for our September and October meetings.
Also move, I'm sorry, no, you want a second?
I'll second.
Okay.
Motion second, one of them. One of these 2 motion and one of them second.
Just whatever you want. So we're going to go from 2 to 4 then.
2 to 4.
Okay.
2 to 4. Is any further conversation on that? Anybody oppose that? Motion passes unanimously. We'll have Brooke update the calendar to reflect that. Then the last one is, oddly enough, our November, December meetings land right on holidays. So, and this happened a little bit last year. So in your packet, we put a proposal to the council that we hold our November, December meeting. It'll be one meeting December 5th from 2 p.m. to 4 p.m. Hopeful that works for the
Friday?
4th or 5th?
It's
I thought it was the 4th.
Thursday, December 4th.
Okay.
Sorry.
I heard it 5th, I just want to make sure.
Well, I may have said the 5th.
And we're gonna do that one from 2 to 4.
We've been throwing a lot of numbers around since about 10 o'clock this morning.
I've already hit 50 hours as of now for my week. So I'm like, what?
I'll make a motion that we do our November and December meetings combined on December 4th from 2 to 4.
I'll second that.
So no November.
Pardon?
December.
December 4th will be
2 to 4.
holding from 2 to 4, and that will, so we won't meet in November, and that will be basically our December meeting here, if you want to look at it that way.
All right, we got a motion, second, any conversation? Seeing none. Anybody oppose that motion? That passes unanimously. We will get a meeting invite out for Thursday, December 4th, 2025 from 2 to 4 p.m. That'll be our last meeting. We usually kind of have a little celebration because of all the hard work. But with that, we are at 3:29. We could actually adjourn early. Somebody made a motion.
I'll make a motion to adjourn. I'll second it.
All right, we're at 3:30. We are going to adjourn the meeting. Thank you, everyone. You're saving lives, doing great work. I appreciate you. Have a great rest of your week and a great holiday weekend.
Thanks, everyone.
Thank you.
Whew.